Quickly, let's talk about the cancer burden in Nigeria. So between 2022 and 2024, the focus of World Cancer Day is to help close the cancer gap. And this year marks the third and final year of that campaign. The theme for this year is Together We Challenge Those in Power. It's a global demand for leaders to prioritize and invest in cancer prevention and care, and to do more to achieve a just and cancer-free world. So the heaviest cancer burden globally is on developing countries like Nigeria, where more than 6% of the world's total new annual cases and over 70% of cancer deaths occur. Yet only 5% of global spending in cancer care takes place in these countries. I'm joined in the studio by consultant radiation and clinical oncologist at NSIA Luth Cancer Center, Dr. Chidebere Agbakuru. Thank you so much for joining us on the program this evening.
Thank you so much.
So very interesting development that we're following here. You look at some really terrifying figures from WHO.
Yeah, they are.
New cancer cases globally is expected to reach 35 million by 2050. That's 77% higher than the figure we had some 2 or 3 years ago.
Correct.
What do you think is responsible for what seems a rapidly growing global cancer burden?
Okay, first of all, I want to say that it's actually close the care gap, not close the cancer gap. It's close the care gap. Yeah. So it's been a recurring theme, and this is the third and the final year of that particular theme, because it's very important that we close the care gap, because you notice that there's a lot of disparity in the kind of care you can get just based on your geographical location alone. And with these new statistics that are coming out, we've seen that the diagnostic statistics are showing that there's a lot more incidence coming in sub-Saharan African and LMIC countries. So that's a big problem. You have to close the care gap. Then, next to what you're talking about, the reason why we're having these statistics that are alarming and very worrisome. So you know, first of all, that there are new diagnostic strategies. There are new ways of detecting cancers, which we hitherto didn't have. About 50 years ago, we didn't have a lot of the technology we have today. So there are new diagnostic ways to find out about these cancers earlier on. Then, of course, lifestyle changes. We're more sedentary now. We're not as active as we used to be. I mean, if you take a poll on what the BMI, about 100 years, the average BMI across a particular age category was, and what it is today is, I'm getting to that actually. So we're actually more sedentary in our lifestyle. We have more remote controls. We have more mobile telephones. We used to have to walk to the phone booth about 50 years ago. Now you can stay in your house and you can do everything. And, you know, the whole working from home thing has actually hit, but we haven't even seen the impact of that yet. That'll probably be in about 10 years from now. So we're more sedentary as a species, and this will manifest in one way or the other down the line.
So they say 1 in 5 people develop cancer in their lifetime. Approximately 1 in 9 men and 1 in 12 women die from that disease. When you look at the figures, it seems that women are more affected than men. Why is that so?
Okay, so are you talking about the global figures or the Nigerian African figures?
Even the Nigerian African figure.
So it depends on the region you're looking at, because some regions have effectively eradicated some kinds of cancers. And I'm talking about cervical cancers here. So cervical cancer is a cancer that is actually exclusive to people who have cervixes, which are women. So Africa and LMIC countries still struggles with eradication of that cancer. So if you look at the global statistics for cancer, you will see a difference between the global statistics for cancer and that in the Nigerian setting, because we are still battling with cervical cancer, which is frankly a preventable and curable cancer. So that kind of makes the statistics look like it's more based on the feminine gender. We also have the fact that, you know, most of the cancers that are in the big 5 are hormonally based cancers, and they tend to affect women more, like breast cancers, and you have other gynecological cancers, which are really accounted for in the major cancers that affect people. So that's pretty much the explanation for that.
Let's try to bring this home. There are concerns about the exit of some major pharmaceuticals from Nigeria. There's GSK that seems to provide some cancer drugs. How much of an effect do you expect this to have in the coming days or coming months, particularly on cancer patients in the country?
Well, it depends on who you're asking, because, I mean, if they're leaving, what it essentially means is that we would have to find substitutes. So in terms of the protocol and regimes for cares, there are generic drugs that you use, but there are also brands that we've become familiar with and we're comfortable with. So I don't think it's too much of a problem. Not that I'm understating the fact that pharmaceutical companies leaving is a problem, but that isn't actually the crux of the problem. I mean, when they were here, how many people could actually afford their drugs in terms of cancer care? Cancer care drugs, and also drugs for chronic non-communicable diseases are really expensive. So I wouldn't really say that's really impacting my provision of care to the patients, because it really is all about healthcare financing and not just the presence of these companies.
Interesting way you've put it. Cancer deaths in Africa is projected to about 1 million per year by 2030. And they say that the issue is that cancer survival rates in this part is quite low relative to other parts of the country. What do you think we're not doing well, particularly when you look at the theme for this year's observance, challenging those in power to do what is right? What is the government not getting right in this regard?
Okay, you're making me skate on thin ice here, because I have to be really careful how I talk about this. But you know, it needs to be said, until you've had someone who's been affected by cancer, you wouldn't really understand the need to talk about these things. We talk about, you know, poverty and the fact that people are really having a hard time now. If you have a member of your family have cancer, you can actually shift from the middle class to the lower class, like in 2 weeks. Yeah. It's a big problem, and we don't have adequate structures put in place to help our people when they slide into these issues. You have families actually abandon their relatives because they think there's no hope. When they hear cancer, they just run for the hills. They don't want to contribute. They don't want to help out. You have health insurance companies. They don't want to cover cancer care in their packages. Why? Because they don't think it's worth doing. I mean, if the government doesn't take it seriously, why should they take it seriously? But this is a disease that has gone from about 5th most common non-communicable disease to, if I'm not wrong, 2nd right now in a space of 10 years. So it is catching up with us, whether we like it or not. And we're going to be the first hit and worst hit if we don't reprioritize and take this seriously. It is a problem.
I agree with you that most people don't want to talk about this. I had to convince my producer to make us have this conversation on this program. King Charles just got diagnosed.
This morning. I heard that this morning.
And has been, very open about, his screening for prostate and what have you. But cancer is perhaps the most expensive disease to treat. My mother-in-law died of stage 4 cancer, a few years ago. And I understand, I saw firsthand the pain that they go through. And I also saw the loopholes in our health system. It's like you just leave them to die. And then they had to tell us to go get some drugs that we can't even access, from the counter. What do you think is the problem here? Is it that we are not prioritizing it in that sense of it, or we don't seem to have, quality health care? Because I'm also concerned about the practitioners. It's like maybe you doctors have seen too many people die that you've lost your sense of care for them in the real sense of it.
That's not a very charitable thing to say.
It is what I've seen firsthand, right? So I have seen doctors. Very charitable. I have seen doctors in government, government hospital. They don't even look at the person in tears, in pain. They just walk past you and say, and just leave it to your fate.
Well, it doesn't mean they're not devoted and they're not committed to their job. So I have to say something. People don't realize, doctors get a lot of stake, and I don't mean just doctors. Doctors, nurses, and healthcare providers get a lot of stake. But if roles were reversed and you actually worked in the circumstances these people worked, you probably won't show up to work. But these guys show up to work every day, crisp, sharp, dedicated, motivated.
You don't want to know what other people are going through.
I understand. People have bad experience. Look, there are bad experiences. I'm a doctor in Nigeria. I know these stories. There's nothing you're going to say now that is new to me. I understand what the problems are. And to be fair to the government, considering cancer care, they've really, really tried in the past 4 years with the NSI Youth Cancer Center. You have to be fair. But that is not enough. It's just one center. And the center cannot cater to all of Nigerians. You have people coming in from all over Nigeria and even the West Africa sub-region to the NSI Youth Cancer Center. And even the workers are getting burnt out. It's a lot. No center should have to deal with those numbers. But we're doing a pretty good job. It doesn't mean that, not positive stuff isn't happening. You have to talk about the positives and the negatives. Now, the negatives, yes, there's a lot of issues with financing. People have issues with financing. If someone can't pay for the medication, can't pay for the investigations, what do? You're stuck. That's a unique position to work out of. And in other countries, they just put it on the computer and they send healthcare insurance, covers it, and they just move forward. But Nigerian doctors have to cajole the patients, have to help, and sometimes actually have to finance these things for the patients. But nobody really talks about that. So I think it's just really complex, and it's not so easy to just point out one thing and say that's the cause. So
let's try to, since we have a doctor here, and oncologist for that matter.
Yes, proudly so. Let's.
So I'm looking at the the big 5 cancers. They say it's breast cancer, what have you, cervical cancer, and the rest.
Prostate, colorectal. Yeah.
But I'm also hearing that 50% of these cancers can be prevented by one's lifestyle. What do you think we have to change right now, to stand a chance of not having this challenge in the future?
Okay. I don't know how much time we have left, but I want to talk about health education. It's very important. We have to understand that these conversations need to be had. Cancer is not something you keep to yourself, okay? It's not something that you run away from. I even have people who say, is cancer communicable? Do they have a problem if their relative has cancer? We don't know so much about this. So health education is the very first thing. Then people need to be aware of their family history. So that's risk reduction. Risk reduction starts with knowing about your family history and being proactive. There's this famous Hollywood actress who had, a strong family history of gynecological cancers and breast cancers, who went and did some gene testing and found out that her chances of getting these in her lifetime were really high. And she had a double mastectomy and an oophorectomy. That's being proactive.
Indeed.
So we pretty much just wait in Nigeria until these things hit us. First thing is to know your family history, know your risk. Second thing is to ensure that vaccine-preventable cancers for the appropriate quarters are adhered to. So there's a vaccine for cervical cancer, which young girls and even young boys, because the cause of cervical cancer is a virus that can actually be transmitted to boys and girls, should have. A lot of countries don't deal with cervical cancer anymore, but we're still dealing with it, and even at a higher volume. It's quite embarrassing and shameful. So we do these things, and early detection also. Even the doctors.
What's the age limit for this vaccination?
So the age limit for this vaccination is there's some considerations there. You have to look at onset of sexual intercourse. It's not so straightforward. You have to see if they've had sexual intercourse in the first place. You have to do the HPV DNA. So, but there's an early point where you start. You can start as early as age 9 for the small kids, but you have to take a lot of other things into consideration before you do limitation.
I'm afraid we have to go now, but I've heard a lot about screening. How affordable, how accessible is screening in Nigeria today?
So it depends on what you're screening for. So there are a lot of cancers you screen for, and you have to do it in age-appropriate manner. If you get up to a particular age, you're supposed to do. So let's use colon cancer, for example, which is one of the most distressing cancers to have. So you have to do a colonoscopy, which is, I won't say, it depends on who you're asking. It might be expensive to some, and it might not be expensive to some. You have to analyze the stool, and you also have to do some tumor markers. So that package alone could be north of 250,000 naira, last time I checked. And last time I checked was about 2 months ago. So depends on who.
And with the way dollar is going up.
Exactly. So Nigerians are in a tight corner now, pretty much.
Consultant radiation and clinical oncologist at NSI Luth Cancer Center, Dr. Chidebere Agbakoro. Thank you so much for talking to us.
Thank you for having me.
Hopefully we'll have this conversation more often.
We should.
Definitely we should. That's our show today, everyone. Thanks for being a part of it. You can watch it again at midnight and at 6 a.m. tomorrow. I am Nifemi Oguntoye.